Tom.
Hey, Doc.
Good to see you.
You too.
So it looks like you're just here for a checkup. Is that right?
Yeah, but before we get to that, I was wondering if I could ask you about this report I got a few weeks ago.
Okay, tell me about it.
Well, my sister convinced me to get this test done that looks at your genes. And they sent me this report, but it's really kind of confusing. I mean, according to this, I'm at risk for getting heart disease. I mean, I'm at higher risk than other people are just because of my genes, I think. Okay, anyway, it says ask your doctor, so I'm asking my doctor.
So what prompted you to get this report?
Well, I said my sister had it done, and she talked me into it. Okay, maybe it wasn't such a great idea to get it done, but it's confusing. It looks like they may have found something, and it's got me a little worried.
Well, I don't think there's any way a genetic test can really tell you if you're going to get heart disease with any certainty. But to be honest, genetics isn't my specialty. It looks like your absolute risk is 5.5 in 100 compared to 4.8 for the general population. Doesn't seem like a big difference, but maybe these numbers are referring to something else. I really couldn't tell you.
Yeah, but aren't there other factors that make that difference more important for some people than for others?
Well, you're probably right about that. Fortunately, to be honest, I'm just not that familiar with this test. Look, I need to look into this a little further and ask some of my colleagues who may know a little more about this. Let me get back to you about it, okay?
Yeah, sure.
Great.
Maybe I never should have gotten that test in the first place, but I did. And I really expected my doctor would be able to use it, or at least explain it to me. I realize he can't know everything, but we have a relationship, you know, and I feel like the guy really knows me and knows my health issues. And the stuff that test was about seemed like basic health stuff. I don't know, today's visit just kind of left me unsure about what to do next.
That didn't go well. This is the third patient I've had this month with a genetic report that I didn't order. I just don't know enough about these reports or genetics in general to really use the results or to help my patients understand them. I do know that they're causing confusion and worry in a lot of people. I could tell Tom wasn't happy that I couldn't help him much on this, but I don't want to give misinformation, and I just don't feel prepared.